Now, in this tutorial, we're going to visualize the definition of renal failure. Now, in the definitions of renal failure, you need to know that what renal failure is divided into two. We have the first one, which is acute renal failure. Acute renal failure is also called the acute kidney injury. Is it clear? So those are the different elements that you have to know. So what is acute renal failure? So actually, the definition of renal failure has certain terms that you must always employ. It is a sudden, that's the first point, a sudden loss of renal function. It is a sudden loss of renal function that is a reduction in glomerular filtration rate. So a sudden loss of renal function is the second element. It constitutes of a reduction in glomerular filtration rate characterized by what? Oliguria. Is it clear? Characterized by oliguria occurring less than 3 months. Is it clear? So those are the different, that is the element that you must visualize in your definition of renal failure. Is it clear? So your first element, the definition of acute renal failure, is a sudden loss. That's the first element of renal function. Renal function is the second element, and that renal function consists of a reduction in the glomerular filtration rate, and it is characterized by oliguria. That is the third form. The oliguria or anuria. That is the third element, and then the fourth element is that it's occurring less than 3 months. Is it clear? Now, we need to know that is the definition of renal failure. Now, this definition of renal failure, you can still use different classifications of renal failure in order to know the definition. We have the referral classification of renal failure. Is it clear? We have the referral classification of renal failure. We have the Akin classification of renal failure, and we have the Cardigo classification of renal failure. Now, you need to know that what Cardigo classification is used both for acute and chronic renal failure. So in this case, I'm going to speak about Cardigo as for the case of acute renal failure, acute kidney injury. So we start with the Cardigo classification. So I'm talking about the classic Cardigo classification because it is the most important classification in the case of renal failure. Are you understanding? So under the Cardigo classification of renal failure, you need to know that what. So you have Cardigo classification is classified into 3 stages. Is it clear? So in the Cardigo classification, you have 3 stages. In stage 1 Cardigo classification, we first have the first one, which is the creatinine. You have the creatinine level, and then the creatinine level, and then the second element in this is the urine output. Is it clear? Those are the characteristics. In stage 1, you need to know that what for the Cardigo classification, you should have an increase in creatinine from the baseline by times 1.5 times. Is it clear? Within the first 7 days. Is it clear? If you have an increase in the creatinine level by times 1.5 times within the first 7 days, or you have an increase in creatinine by an increase or a change of 0.3 milligram per deciliter within 48 hours, it means that the patient is having an acute kidney injury. Is it clear? So it means that what it is either meaning that what within 7 days you multiply the initial value, and then you are by 1.5 times, you are going to have the final value of the next day within 7 days, or you have an increase by an amount of 0.3 within 2 days. Is it clear? Now, in the case of the urine output is going to be more than 0.5 mils per kilogram per hour for 6 hours. Is it clear? That is the Cardigo stage 1 classification of acute kidney injury. Now for the stage 2, if you have an increase by times 2 within 7 days, it is a stage 2, not a stage 3. It is stage 2 category classification. While for the urine output, if the urine output is 0.5 mils per kilogram per hour for 12 hours, it means that the patient is going to have stage 3 category. Now the next one is a stage is that's for stage 2 category. For a stage 3 category classification, we need to evaluate that what for the stage 2 stage 3 category, the creatinine level should increase by times if you have an increase by times 3 times within 7 days, or you have an increase by an amount of 4 milligram per deciliter within 48 hours. Is it clear? Within 48 hours, it means that it is a category classification stage 3. Is it clear? Or if they say urine output of more than 0.3 mils per kilogram per hour for 24 hours, it means that it is a stage 3 category acute kidney injury. So that is based on the category classification. That is how we are going to classify acute kidney injury, and you can just use this definition to say that it's a definition of acute kidney injury. So let me just give another definition of acute kidney injury based on the category classification. So acute kidney injury based on the category classification says that what if you have an increase in 1.5 times the baseline creatinine by within 7 days, or you have an increase of 0.3 milligram per deciliter within 48 hours, or you have a urine output of less than, so it's not more than, a urine output of less than 0.5 mils per kilogram per hour within 6 hours, it is the case of acute kidney injury. So all this, sorry, it is instead less than the rather than more than. In this case, you are talking about anuria or oliguria. Is it clear? So those are the different elements that you have to speak about. Okay, now after speaking about that, we are now going to visualize the refill classification. Now refill classification is just telling you that what it's just telling you that actually in the case of the refill classification does not grade the severity of the renal failure. It is instead grading the loss of the provided that we don't do anything, we are going to have the loss of functioning of the kidney until a end stage renal disease. So you need to know that what the first R is going to be for the risk, meaning that what for all renal failure we first have a risk, particularly acute renal failure, we have a risk. If the risk is not taken care of, particular example, we have dehydration, then the patient is going to have an injury to the kidney. That is, the patient is going to have an oliguria due to this by the compensation mechanism. Now if there is injury and it is not cared of, the patient is now going to have a renal failure where you are going to have a reduction in the glomerular filtration rate. And you need to know that what the normal value of the glomerular filtration rate is approximately equals to 275 mils per kilogram per minute. Is it clear? For the glomerular filtration rate, the normal value is 135 mils per kilogram per minute per 1.73 meter squared body surface area. Is it clear? So that is so in this case you're going to have a reduction. When you have a drastic reduction, you have now a failure. After the failure, now the L now is loss of functioning, meaning that the nephron are not going to function again, and if still nothing is done, you're going to have an end stage renal failure. Is it clear? So there are certain cases where you have an end stage renal failure directly from an acute kidney injury, particularly that occur when you have a rapidly progressive glomerulonephritis. Is it clear? When you have a rapidly progressing glomerulonephritis, particularly, it is the one that is going to result to an end stage renal failure. Is it clear? So those are the different elements that you have to visualize. So now that is for the definition of the acute kidney injury with its classification. Now we are going to visualize now the definition of chronic kidney disease with its classification.